Welcome back to the Doctor is In television program. I'm Dr. David Morwood. I am a board-certified plastic surgeon right here in beautiful Monterey, California. Thank you very much for joining us today. I'm delighted to welcome back as a guest the very illustrious, incredible head and neck surgeon, Dr. David Auerbach. Dr. Auerbach, thanks very much for being here.
My pleasure. Thanks for having me on your show.
Now, Dr. Auerbach, you are board-certified head and neck surgeon.
Correct.
So the first thing I want to clear up or teach to the public and also fill me in is that sometimes you guys are called head and neck surgeons, ENT surgeons, otorhinolaryngologists. Isn't that correct?
Very correct.
So what I want to do is give me a little background as to how you guys got your multiple names.
Sure.
And I want to talk a little bit about the training. How do you become an ENT surgeon, head and neck surgeon? I want to talk a little bit about your day and your training and your credentials, etc.
Sure.
So what is this business about a head and neck surgeon is the same as an ENT surgeon, is the same as an otorhinolaryngologist?
Well, I think it just, these various names developed over time for all sorts of reasons. Years ago, back in the actually 30s and 40s, it was an eye, ear, nose, and throat surgeon, or an eye surgeon and otorhinolaryngologist. There was not a separate ophthalmology and ear, nose, and throat area. After World War II, they sort of branched off. Ophthalmology became much more involved with increase of techniques and knowledge, etc., and ear, nose, and throat became involved. As ear, nose, and throat became involved, there was also this background name of otorhinolaryngology, which were terms for oto, ear, rhino, nose, and laryngo or laryngology is the throat. So it was sort of a fancy term, but a lot of people couldn't pronounce it, weren't sure what it was. And then as it progressed, a lot of people thought, well, ENT, they just sort of see allergies and sore throats, and we do quite a fair bit of surgery. In fact, the first microsurgery ever done was in the ear, middle ear surgery, moving ossicles around using a microscope. That was done in the late 1800s, early 1900s. First recorded microsurgery.
That's incredible.
So with the advent of also treating head and neck cancer, being involved in resecting large tumors, thyroid disease, throat cancer, etc., people thought, well, is that a throat problem? And they started to say, well, they're head and neck surgeons. But then it got confused, well, we don't really do neck surgery as in spinal issues. So there's some confusion there. So my society is called the Society of Ear, Nose, and Throat Head and Neck Surgery /
Okay.
So that's what it is. But
Catch it all.
Catch it all. So that's how the evolution, what it's called.
Okay, now Dr. Auerbach, like many specialties, well, like medicine and surgery in general, people are becoming highly specialized. Correct? So there are some head and neck surgeons, for example, who will only do ears, or they only do pharyngeal and laryngeal problems. Some doctors only do noses, for example, both reconstructive, plastic surgery, tumors, etc. So in your particular practice, do you have a field of subspecialization within ENT, or do you cover the spectrum of ENT problems?
Well, I guess one way to answer that is that I'm in a group of 8. There's 7 other surgeons in my group, all board certified. We cover the whole area, really. Monterey and Salinas, we cover all 3 hospitals, the emergency rooms there. Within our group, amongst all the practitioners, some have interests, whether it's an interest that you just developed because you like the area, or something that maybe you did in a little extra training after your surgical training. You spent an extra year or 2 in fellowship. We have our newest member, Dr. Amit Grewal. She did an extra 1 year at Stanford doing thyroid and head and neck cancer. So she has an interest in thyroid and parathyroid disease, and sort of gravitates to that. That being said, she still does a lot of other areas. We have some people who have an interest more in ear surgery, some people who have a bit more interest in pediatrics, have 1 or 2 people doing a bit of cosmetics. So we sort of run the whole thing. And there's really not too many ear, nose, and throat procedures that we don't do within the scope of our group.
Okay, so Dr. Auerbach, that's important. You mentioned you're in a group of 8.
Correct.
And what's the name of the group?
Central Coast Head and Neck Surgeons.
Central Coast Head and Neck Surgeons. So before the end of the segment, I want to give a contact website or phone number.
Thank you.
Because I think to have you guys on the Central Coast, a group of 8, covering just about every segment of your specialty is really valuable for the public to know about.
Thank you.
So you mentioned your new partner, your new colleague did a fellowship.
Correct.
What I'd like to do is educate the public about what it takes to become a board-certified ENT surgeon,
Sure.
head and neck surgeon, and then I want to zero in and talk more about your training and your background. I understand you've done some research and you've worked in laboratories. I think you have a master's degree,
yes,
as well as an MD.
Yes.
That's really terrific. So let's talk about what it takes to be a head and neck surgeon. What's the training like? And in fact, let's just picture or imagine there's a really smart high school student listening and watching. Who makes a good head and neck surgeon? Like, who do we want to attract from the high schools and colleges to go to medical school to become a head and neck surgeon?
Great question. I think it's anybody who has an inquisitive mind, likes to do things with their hands, and has good people skills. You want someone who likes to interact with patients. One of the interesting things about ear, nose, and throat, head and neck surgery, I'll just call it ENT for short here, is that as a specialty, it really, as a surgical specialty, it's really quite blessed because you get to do a lot of things. You get to spend a fair bit of time in the office with patients, so there's a fair bit of a primary care aspect to it. You also spend as much time as you can or want really with surgical cases in the operating room. As well, it runs the whole age. We have, we're not confined to one specific age group or demographic. So we see, I've operated on kids who were 2 or 3 days old, and I've operated on patients in their 90s. So you really have this wonderful, ability to have, to really do almost anything, more in the office, more in the operating room, certain ages, certain issues. So it has the whole breadth of that, so I think interacting with patients, an inquisitive mind, liking to do things with your hands, liking to give back and contribute and help people, I think that's the type of people that you want to attract.
Well, Dr. Auerbach, that's very helpful and excellent for you to outline like that. Now let's talk about your specific training and your background. Now I think you did some training in Montreal?
Toronto, close, yeah.
Toronto.
Yeah.
Okay, so you finished high school, of course, and then where did you go to college?
I went to college, University of Toronto.
University of Toronto.
Right. And
that's Eastern Canada.
Eastern Canada. Decided to stay there for medical school. Well, was accepted there in medical school, so I went through medical school there. And then halfway through medical school, I was interested in surgery. I was interested in, different parts of the body interested me. And I found the anatomy of the head and neck area just fascinating. The throat, the ears, the neck. I mean, it's just a phenomenal conduit for all these for all the senses really that are coming through. So I did a couple of rotations with people in that specialty and became interested in it, applied to various programs, and got into the program in Toronto, so I stayed in Toronto. Although I did some training, you have to do 1 or 2 years of general surgery training prior to entering the ear, nose, and throat program. So just to get a broad general, surgical knowledge of how to conduct yourself in the operating room, how tissue handling, et cetera, that we've all done as surgeons. And so for that, I went to UCLA and then came back to Toronto and finished my training there.
Excellent. And you did you have a master's degree.
Yeah, halfway through, they sort of encouraged in my residency, halfway through, if you were interested in research or interested in doing some type of research, either just spending time in a lab or if you want being a bit more aggressive in getting your master's degree. So I happened to work in a lab of a wonderful, actually a plastic surgeon you may know of, Nancy McKinnon.
Of course.
Who now I think is in St. Louis. Isn't there a Washington University in St. Louis?
Correct.
I think she's there. And she was my mentor along with another woman named Nancy McKee. And they had a lab with some nerve grafting and setting up a nerve bank. We were doing some work with microsurgery and nerve grafts. And so I decided to get my master's degree, which meant taking courses and as well doing lab work and putting together a thesis. It was just it was a wonderful time.
Excellent. So Dr. Auerbach, you not only have an MD, of course, you're board certified in head and neck ENT surgery, and you also have a master's degree.
Yeah.
Well, that's wonderful.
Kept me busy for a while. Yeah.
I understand. Now, before we go on to one of the things I want to teach the public about, you are also not only a practicing ENT surgeon, you are a medical director and you're on the board of the Monterey Peninsula Surgery Center. Isn't that correct?
Yes, it's a local surgery center that's been around for about 35 years. It's affiliated with both hospitals, Salinas Valley Medical Center and CHOMP, Community Hospital of Monterey. And we do quite a few outpatient procedures per year, over 16,000 per year. Most surgeons in the area do some or a lot of their work there, and we're quite well known in the community, have great relationship with the hospital and a significant part of the medical care here.
Well, I understand it's really more than just a local surgery center. I think the volume of outpatient surgery that's done at Monterey Peninsula Surgery Center is one of the highest volumes in any institution. Outpatient surgery.
Outpatient surgery in California, it's probably ranked, I think it's 6th or 7th, behind a few Kaisers and Stanford and a few other places. I don't know exactly, but it's number 6 or 7 in terms of outpatient volume.
It's busy.
It's very busy, yes, we are.
Excellent.
Yeah.
Okay, so Dr. Auerbach, one of the things that I
Sure.
want to teach the public about, and as I look at the clock, we may have to invite you back, a lump in the neck.
Sure.
Now that's a very broad topic.
Very.
But for sure, when someone is shaving or putting on makeup or tying a scarf or doing their tie,
Right.
and they feel a lump in the neck,
Mm-hmm.
I think universally people get scared, right? So what I'd like to do is teach the public about this term we call workup,
Mm-hmm.
right? So an ENT surgeon will take steps to figure out what a lump is.
Right.
And of course, we want to emphasize that sometimes a lump in the neck represents something dangerous, like cancer.
Correct.
Oftentimes, it is not cancer, but still has to be addressed.
Correct.
So I wonder if we could address the workup of a neck lump according to age of the patient. For
Sure.
example, let's say a 3-month-old baby is brought to you by their parents with a midline neck lump,
Mm-hmm.
a few centimeters under the chin. Let's say parents bring in a 6 or 9-month-old baby with a growing lump on the side of the neck, a few centimeters below the ear.
Mm-hmm.
Now let's compare that to a 39-year-old woman
Mm-hmm.
who is putting on a scarf or sees a picture of herself and she notes a lump kind of on the side of, women don't really have an Adam's apple, but the
Right.
cricothyroid cartilage.
Right.
She notices a lump there
Right.
and it feels firm to her. And let's contrast that to, say, a 72-year-old man who has been smoking for years and drinks and notices a painless lump under his jaw.
Right.
So this group, or this term, neck lump,
Right.
neck mass, and I'm sure I'm going to try to get you to come back on the program. Let's teach the public what we mean by a workup in general for a medical doctor or surgical doctor, and let's talk about more specifically the workup for a neck lump.
Sure.
How does that go on in your office?
It's a great question. Well, first, I guess I could go back to even looking at 30,000 feet, saying if someone notices a lump, either on themselves or their child, what do you do? And I think the first thing is don't panic, because nothing bad's going to happen that moment. But the best thing to do is contact your primary care physician, whether it's a pediatrician, whether it's your primary care doctor. And usually after talking or seeing you or feeling it, most probably, if there's a concern, unless it's a little boil or infection or something, a bug bite, they'll probably, if it's a true lump under the skin, they'll probably get you to see myself or one of the other ENT people in the area. What would we do as the workup at that point if someone walked in the office? And as in any workup, the workup consists really of a few separate things, but the first thing, of course, is the history. And the history means just asking the patient about it, how long it's been there, the symptoms, or, of course, if it's a child, getting it from the parent. And so often we can tell from that, most of the time, a fair bit of the time, you can almost get the idea of what it is from the history. And history also includes what we would call context, is that 3-month-old or 9-month-old or anybody under the age of 5 or 10, to have something bad going on as a neck lump can happen, of course, anything can happen, but extremely rare. Whereas you have on the other end of the spectrum, you mentioned someone who's in their 60s and 70s, been a long-term smoker, finds a very hard lump in their neck. Yeah, of course, there'd be more concern. Either way, as you said, there's still a workup that we would have to do to get more information. So the first thing would just be to ask them how long it's been there. Often we see with little children, if they have small lumps present, very often they're born with them. And they can be born with these lumps, and these